Hi, my name is Dr. Alex Hernandez, and I'm a chiropractor in New Jersey. I have a specialty in sports injuries. So I am someone that has helped a lot of soccer players, runners, tennis players, and also some American football players. Right now, the major thing that I see is knee injuries, ankle injuries, shoulder injuries. These are the top 3 injuries that I see in my practice. And of course, it's because we use these in all the sports that we play in. So soccer, it's self-explanatory. You're going left to right, back and forth. You're following a ball, and it's very high intensity. So there's a tendency where your jump land wrong or somebody comes and hits you. So that's where you have many of your ankle sprains or your knee sprains. One of the things that we've seen with certain athletes is they've had some old mild injuries where they kind of didn't do really anything about it, and they begin playing their sport after, say, 6 months or a year, and they start to feel like something is not right. Either their gait is not right, they can't turn left to right, they know something is not right. Those are ideal people to come see me so that we can actually address that injury and they can go and play 100% versus going out and playing 70%. That's a good time for somebody to come see me. We have a young athlete, he's a young soccer player, he's 13 years old. And he had a big tournament where there were gonna be scouts at this particular game. It was between New York FC and the team that he plays for. So the mother brings him in, and the boy is obviously upset because he thinks he's not gonna be able to play this game. Very important game, so I ask him, I was like, what's going on? Why do you look so sad? And he tells me, well, there's scouts at this game and I don't think I'm gonna be able to play. Look at my ankle, it's gigantic. And sure enough, he had a high ankle sprain. And I told the mom, I'm like, well, it's kind of tight. We're really literally 2 weeks to this game and his ankle is this big. So I'm looking at myself and I'm looking at him, I'm looking at his mom. I'm like, I'm gonna give it my best shot here. So in this instance, we worked with him 2 days a week. We got him to about 70%, enough to be able to play half of that game. Enough for him to be showcased and for him to be seen by the scouts. And that's what I told him. I said, look, we're gonna get you to this point, but I promise that you only have about maybe 40 minutes the most on this ankle. So he played the game, his coach was surprised, and he was very happy. The mom was very happy, of course, as parents, we want our kids to be happy. So this is an instance where we can get these dramatic results in a short period of time. And of course, we use our specialty techniques, laser therapy, our soft tissue instruments, and all of these things that really take into, it's a recipe for getting the person back in the game quickly. I teach a lot of the people that get injured in my office, we teach them about form. Particularly, let's talk about the shoulder. People go and they are benching, and I can say when I was in high school, I would bench wrong. Everybody bounces the bar off of their chest, hyperextending the shoulder joint. This is a very common example. And when you're hyperextending your joint, you're creating micro trauma. And you do this over and over, week in and week out, and eventually your shoulder is gonna get injured. As I had a gentleman get hurt in CrossFit because he was doing dips, hyperextending his joints, and using improper form. So some of the things that we teach the athletes is how, once you've injured yourself and you've healed, okay, this is what you need to do in order not to get hurt again. So form is really crucial to teaching the athletes getting back to their game. In communication with coaches, but more particularly the parents. The parents talking to their coaches because they're there when they're playing the game. And they know who got hurt and they know who healed them and who got them back to a proper form. I'm blessed to know 3 languages, English, Spanish, and Portuguese. And I can communicate with the parents, I can communicate with the students in Spanish. So it gives me an advantage to be able to tell you your injury in your native language so that you can understand exactly how you got hurt, why you got hurt, what you need to do, and how you're going to get back into the game in your language. And this is a very crucial thing that people relay back to me. They'll say, you know what, it makes it easier for me to come here because you speak Spanish. or I can communicate with you in Portuguese. And that does give me an advantage on being able to better communicate my point across and having you understand it as well. I guess the most important thing to remember is, and this is the last thing that I teach the athletes once that they're injured, is learn to be a smart athlete. Learn to use proper form, proper technique. Don't get caught up on lifting so much weight to show off in front of your buddies or in front of your athletes. And know that it's not healthy to play a game 7 days a week. Whatever sport you're doing, you need to give your body a rest. It's important that you don't play a game 7 days a week. And with my last point, I had a father who his boy was playing for 2 soccer teams, 7 days a week, pretty much. So he was going to his regular team practice, then he was part of a traveling team. So I asked him, I said, when do you rest? He's like, I don't. I play all 7 days a week. This boy is 10 years old, ends up at my office with sciatica. I don't take care of 10 years old with sciatica. That was my first case ever. And I told the parent very clearly, we are overtraining our kids, and this is why they're getting injured. So returning to the game, being a smart athlete, having great form, and not getting focused on getting caught up in I'm lifting extra weight, or I'm benching 400 pounds, or I'm squatting 600 pounds is very important. I don't think many parents know, and I don't think many coaches understand. We're so focused on performance, and we want, as parents, the best for our kids. Obviously, everyone's racing for the scholarship, or if we're becoming the elite athlete, and sometimes we forget that these are just kids. And I think definitely there is room for conversations to have with parents regarding their kid. And in this particular example that I gave you, I told both parents, I said, look, honestly, you're overtraining this kid. He's gonna get hurt. And he may not even like this sport anymore because he's doing it 7 days a week. And that's terrible. You want him to carry on, go to high school and go to college, but you don't want him to hate this sport. And I can tell you that as an athlete, and when I ran in college, we were running so many miles that by junior year, I just didn't want to run anymore. I got burnt out, and I was basically doing just to complete my duties as a scholarship athlete. And we need to make sure that we do have these conversations with parents that not to overtrain their kids. So this is communication three-way between coaches, parents, doctors, and also the students. The student needs to understand you can't do this 7 days a week and expect your body to respond at an elite performance. Professional athletes take a rest as well. It's important that you protect your son or your daughter. You don't want to risk a more serious injury in this short period of time, and the time that you're supposed to be having a good time with a child and they're supposed to be enjoying their sport. If you want to see this child not hate this sport, it's time for you to tell him or her that you need to break, you need to have a rest. You can't belong to 2 teams at once. You can't do cheerleading 7 days a week either. It's gonna dry them out, and they're gonna hate it. They're gonna get burnt out at such a young age. You should not have a 10-year-old being burnt out of the sport. This is gonna be your responsibility, and you gotta understand that you're hurting your child as well. So what I want you to do is, I want you to, at any moment, ask me, pick up the phone and ask me any questions. Or if your daughter thinks she may have sprained her ankle mildly or her shoulder mildly, and you think it's not wise for her to go to that cheerleading session or that competition, I want you to call me, and I will give you my professional opinion whether she should play or she should not play.